My name is Dr. Karen Price. I'm the President of the Royal Australian College of General Practitioners. We are a college that invests in GP members for developing education standards, accreditation and ongoing support.
My name's Leanne Wells and I'm the Chief Executive Officer of the Consumers Health Forum of Australia, CHF. CHF's main role is to be the national voice for patients and consumers in the big national health policy debates. And what we really try and do is shape better health policy and service design in the best interests of patients.
Hello everyone, I'm Dr. Leanne Beagley and I'm the Chief Executive at Mental Health Australia. Mental Health Australia is the national independent peak body for the mental health service sector, which includes providers, the workforce, consumers, carers, and researchers and academics.
Social prescribing is all about health and wellbeing support. So practically it involves a health professional providing a consumer with a referral for non-medical, non-clinical services as part of their overall health plan. And we know that that's important for people. Evidence from overseas tells us that when people are accessing services in the community, they're feeling more connected with family and friends, they're doing things they enjoy, then they're better able to self-manage chronic conditions and they feel better and it promotes wellbeing more generally. So we think it's important. Why does the public need it and why does the public need it now? Well, we've heard so much conversation about the impact of COVID. It's certainly accelerated and exacerbated a sense of social isolation and loneliness for many people. That needs a healthcare response and a social care response. We also know that mental illness is a growing problem. We know from data collected by the RACGP that it's the most common thing that GPs see patients for. And we also know from data that we've collected that around 20% of people primarily go to see their GP for social problems rather than clinical or medical problems. So that's telling us something about the need for coordinated health and social care in our system. To us, it makes sense for that to be integrated and part of the primary care world and part of what primary care services like general practices and Aboriginal community control centres and community health services do. There's an emergent practice in social prescribing in Australia. Some PHNs are already commissioning social prescribing services. So it's really starting to gain traction, but it's still fragmented. And we think particularly where the government's developing a 10-year primary healthcare plan and a longer-term preventative health plan, that's why we've joined together with the RACGP and Mental Health Australia to advocate for a well-funded national social prescribing scheme.
GP's concerns on mental health are wide-ranging because we need to understand firstly what mental health is. And that is just something different from mental illness. Everybody has mental health to some degree, and it's from a point of languishing to flourishing. If we look at it on a sort of a scalable kind of effort. And what we're concerned about is that particularly during COVID, that there's been an enormous presentation of mental health burdens and distress out in the community. So this is, I want to be sort of say that it's something a little bit separate to mental illness, which is, also a distressing part of our practices. But, we are seeing by far and away the majority of patients presenting with a component of mental health distress. This is the number one concern of GPs in the Health of the Nation report, and they reported this as being the most common presentation they see in clinical general practice. And certainly myself as a working GP, I see this too, that nearly every consultation, no matter what people come in with, has a component of mental health issues that need addressing for that person.
Clinical intervention is really important in dealing with mental illness. And when mental ill health is identified, wherever along the continuum of care from early signs right through to serious mental illness, clinical intervention is critically important. And there's a long way to go to providing access for people across the board to clinical intervention. And we're very keen to see that develop. However, social prescribing is an opportunity to both provide an adjunct to clinical intervention and support system in the community, but also to identify problems early and intervene early. And so when people are disconnected, isolated, lonely, or needing some kind of engagement in the community to support their broad mental health and wellbeing, social prescribing is going to be a fantastic opportunity to do so. And the research is telling us that it's a critically important early intervention and prevention strategy for people with mental ill health.
Starting with families and carers, it's so important for people who are experiencing mental health problems to have a sense that their family and their carers are aware of their issue and can mobilise and organise around them to support them. Like trusted healthcare providers, GPs and pharmacists, for example, family and friends are also trusted. And, you know, when you're getting advice and support from family and friends about where you might like to go for treatment, but more importantly, family and friends can just really help bring out the fact that someone has depression or anxiety, because stigma is such a big thing still in society. So to have your family and friends do really fundamental things like ask, are you okay? And to acknowledge that someone might have depression or anxiety, for example, normalises it and really can encourage help seeking early, which is really what we want to see, early help seeking supported by family and friends.
Social prescribing is being slowly implemented around the world, but I think GPs have been doing that for a long time anyway, but without much support. And particularly for patients who have low resources, this becomes very difficult, even getting someone out to a community health centre. These things are very, very challenging, and to have some support for those resources would be really helpful.
The National Agreement for Mental Health and Suicide Prevention is something we're expecting from governments across jurisdictions to be delivered during November 2021. That was a promise and a commitment made by the Prime Minister a year ago. And we understand that agreement is close to being provided to the community. The reason that it's so important is because all levels of government have a responsibility and an interest in mental health and ensuring that mental health services are provided for communities. But sometimes they're not well coordinated, well governed, are accountable, and they're not integrated and well planned. And the national agreement should give us that. The national agreement should give us a comprehensive structure for reform of the mental health service system so that people on the ground and in their communities can access care across the board. And importantly, primary care, that is, GPs and providers in the community, are an incredibly important part of integrating services across federal and state boundaries. And so the national agreement is absolutely critical in ensuring that social prescribing and mental health services more broadly can be well integrated into someone's journey and into someone's clinical care.
Straight away, because we're already doing it, but to have more resources for patients, particularly the vulnerable patients, would be excellent. And we know it has flow-on effects. It's actually an investment in their mental health. We know that this reduces people's productivity, it reduces their ability to get out and about and exercise, for instance, and contribute to the management of their chronic health conditions, which are often occurring in combination with mental health distress. So it's a whole of health approach, and that's what we're really looking for, some support, particularly for vulnerable patients.